Hi, my name is Micaiah James, and I am a community health worker in St. Joseph, Missouri, located at the Social Welfare Board, which is the oldest free clinic in the United States. I am here today to discuss why a community health worker position should be created to prevent visits to the emergency room by implementing diabetes management. First off, diabetes is a chronic disease in which the body's ability to produce or respond to the hormones insulin is impaired, which results in abnormal metabolism of carbohydrates and elevated levels of glucose in the blood and urine. Type 2 diabetes is a long term metabolic disorder that is characterized by high blood sugar, insulin resistance, and relative lack of insulin. Although there is no cure for diabetes, there are treatment options to help manage diabetes more effectively. Interventions engaging community health workers for diabetes management aim to improve diabetes care and self-management behaviors among patients. The interventions use one or more of the following models of care, which are screening and health education, outreach, enrollment and information, being a member of a care delivery team, patient navigation, and community organizers. I received the information from www.communityguide.org. Community health workers typically serve those who are poor, underserved, and diverse communities. Community health workers demonstrate an important role in providing ongoing support. Providing ongoing support and make it much easier to provide health education and bring awareness of diabetes. Managing diabetes doesn't have to be hard. Most clients just don't know where to start or have a hard time accessing certain tools, for instance, healthy eating. In the Chapter 17 handout, it stated that American diet has become less healthy over time. Community health workers have resources to healthy foods or pantries that often provide diabetic meals for those who have a yellow card. Community health workers may not know the full details of nutrition information, but they also know where and who the experts are that can help direct the clients to their certain needs. A yellow card in St. Joseph, Missouri is given to anyone who lives in the city perimeter, which is located at Second Harvest, which is a Fresh Start pantry which allows individuals and families to grocery shop once a week. Exercising is also a prevention method of diabetes management and a great way to lower blood sugar levels and overall just remain healthy in general. Exercising doesn't have to be expensive, such as a membership or purchasing equipment. It can be taking time out the day to walk around the block to keep the balance of the blood sugars levels balanced effectively. Especially if a client is overweight, it will be easier to stabilize blood sugar more if they lost a few pounds, such as 5 to 10 pounds. Diabetes can impact all aspects of life, and all aspects of life can impact diabetes. There are several challenges of managing diabetes. It can be difficult for people living with the disease to stay on track. As a community health worker, setting goals with a client can help them achieve goals such as eating, exercising, checking their blood sugar levels, and reducing stress, and etc. As I mentioned before about reducing stress, a community health worker can refer a client to see a therapist to help reduce as much stress as possible. Excessive stress can actually cause blood sugar levels to rise due to an increased release of stress hormone, which is cortisol. It often increases cravings for comfort foods and interferes with good sleep. Community health workers can help find ways to reduce client stress if they're worried about such things such as housing, disability, education, employment, or etc. We're here to help bridge the gap of unhealthy barriers and to help clients achieve long-term health. Another great method, a community health worker can help clients manage diabetes if they're checking their blood sugar levels. When blood sugar levels aren't managed, hyperglycemia and hypoglycemia can occur as levels rise and fall drastically. Although teaching a client how to prick isn't a community health worker's job description, we can make sure that the client is doing so. Most people with diabetes need to check their blood sugar regularly. There are several ways to this test, such as finger tipping, upper arm, thigh, or forearm, and glucose monitoring system. So all in all, I feel that the hospital association should decide a community health worker position is a great way to prevent hospital visits for clients and patients by just basically being their ongoing support, things that they feel the need they're not educated about. We can educate them and help them guide resources to remain from being in the hospital. So that's what I got.